Hello, everybody. This is Kiyoshi Koyano from Japan. Today, I'm going to talk about implant overdenture for maxilla. As all of you know, that implant overdenture is a good treatment option for edentulous elderly patients. And ITI Treatment Guide Volume 9 says that benefits of the implant-supported overdenture in edentulous elderly patients are as follows. Number one, improvement in denture retention and stability. Number two, promoting psychological and physiological denture adaptation. Number three, prevention of bone atrophy. Number four, improvement in chewing efficiency and bite force. Then, number five, improvement in nutritional state. Number six, promotion of self-confidence in the social context and psychological well-being. Number seven, increase in treatment acceptance through the proposal of less invasive procedure and maybe easy to handle and straightforward to clean. And also ITI Treatment Guide Volume 4 describes about the indications for loading protocols with mandibular overdentures, as you can see on this table. Then dark green stands for the scientifically and clinically validated, and light green shows clinically well documented. As you see, the two implant overdenture either splinted or unsplinted, and also fourth implant overdenture either splinted or unsplinted those are scientifically and clinically well validated.